My basic involvement is basically with cystic fibrosis and the manifestations of cystic fibrosis, which is a far wider disease than what often doctors and hospitals and think it is. Traditionally it's thought of as being a disease which affects the lungs, also can affect the bowels, occasionally can produce infertility in men, and that's about it. But with Reva's experience, it's shown that it also has caused cardiomyopathy. We can pretty well assume that the parathyroid adenomas are a result of cystic fibrosis and that. And she's got Sjogren's syndrome, which is probably an inflammatory response to the chronic infection of cystic fibrosis. She's got pulmonary hypertension. You name it, she's got it. And this is really the result of, I believe, the result of the fact that, cystic fibrosis is not only, in blocking the chloride channel in the wall of the cell, it not only produces a thick mucus in the mucous membranes, it also causes aberrations in the electrolytes within the cells. Potassium, if chloride is high, then your potassium will be affected, your sodium will be affected, and calcium will be affected within there. So it's basically, and that's, it's been shown to produce calcification in the heart on that, and in other cells too. For most of that 50 years, we didn't know that she had it. And there were things happened which posed difficulties. She had no trouble getting pregnant, and we had a child before we went. We had two children before we went to Africa. We lived in an agriculture college in Kenya at about 7,500 feet, and we were there for two-year stints. And at the end of the second year, she started having fits. And she, at that stage, we didn't know why. She had previously been to India and living in the Nilgiri Hills, again about 7,000 feet. She got ill, came down to the plains to Vellore Christian Hospital down in the plains of India, and she recovered on that. So basically, with Edgerton College, we were at 7,500 feet, and we found that she couldn't take the altitude. So we got pensioned off back home. The missionary society that sent us there wouldn't send us back. No wonder. And then she started having medical problems, issues, trying to work them out. Our GP had great difficulty trying to work out what was going on. He couldn't. She had chronic bowel disease, went on and gradually got worse and worse. Then was diagnosed with a heart problem in mid-90s, and gradually that, 2000, the bowel disease got to the stage where finally the surgeon threw it all in the bin, and she was had ileostomy on that, and basically so it's continued from that, and it's just progressed from there. That was about the time we started to suspect, could it be cystic fibrosis? She'd been diagnosed with atrial fibrillation. She didn't respond to the normal medications for that. They finally did a AV node ablation and put a pacemaker in. That proved difficult, and was never a great success on that. And later on, about 2005, they found that the heart was enlarged. There was cardiomyopathy there. And that was still, at that stage, they didn't know that she had cystic fibrosis. The surgeon that removed the bowel, we asked him, could it be CF? Oh, no, not possible. She'd be dead by now. That was the answer. Finally, 2009, she was sent to a respiratory specialist to see why did she have atrial fibrillation. Was it the result of sleep apnea? And that respiratory, Michael Sutherland in Kew, took the history down, and after he'd taken that history, we posed the question, could it be cystic fibrosis? And he looked up his history and said, could be, easy enough to test. And he proceeded to test. About 6 months later, we had the results of the testing. She was a compound heterozygous person with cystic fibrosis on that. On one chromosome, she had the mutation G542X, which on that. The other chromosome, she had the mutation R75Q, which is because about 1% of people with CF. It did present restrictions on us. Reva was often tired, and yet she achieved a lot. She did support me in my veterinary practice. She was my receptionist for quite a few years. She did, when we came back to Melbourne, she did go back and complete a degree in occupational therapist. She trained with a diploma in occupational therapist back in the 60s. She upgraded that to a degree, and she did complete that. And she also did a degree in theology, on that, and then was doing a second degree in theology, a master's of theology. And she got virtually to the end of that, and the last subject, she just got too sick to be able to complete it. Looking after kids was a burden, and she was often tired, times very tired. No, we had 4 kids by that time on that. And that tiredness and shortness of breath on that was problematic. And also the medical situation, we were trying to sort of find out why she's having these medical problems. Nobody could give us an answer. No, the bowel disease was there, medical appointments, I'd often have to go off with them. No, so it did affect my work, that it was distracting, and I had to fight against that. It meant that, okay, at times I'd have to cancel appointment times because of that. She ended up with quite a number of hospitalisations over the times. That doesn't make it easy to run your own business.
What about these days?
And well, now I'm retired. I retired about 3 years ago, and it's predominantly my main job now is looking after her on that. I do get involved in a few other things, but it does limit to how much I can on that. Well, this has always been a problem, is trying to sort of get doctors to look at it and work out what is really going on here. Because for years, like she was told I couldn't possibly be CF, the bowel, and had we known it was CF, it might have made a huge difference in the way the bowel was treated. It may not, had she been on appropriate medication, Creon from, say, back in the 80s, it may well be that the bowel didn't need to be removed. But it's been removed, that can't be reversed. The atrial fibrillation. Okay, trying to work out, why did she have that? At first they just assumed some people got it and some people didn't. They didn't look for a reason. If a reason wasn't obvious, okay, we just treat it, instead of looking for a reason. And that meant that, okay, eventually she had the AV node ablation and that, which is irreversible. She's now pacemaker dependent. The pacemakers are not particularly good with her. They don't, on that. And there's a reluctance, at the moment the pacemaker she's got in there is one which is probably obsolete, but nobody wants to replace it. They just, say on that, yeah, the indications are that. So trying to talk to doctors, get them to do things, various other things. She recently had 2 parathyroid adenomas removed. We knew that because she'd previously had an adenoma removed in 2007. And after she'd been discovered with hyperparathyroidism, it returned. But we knew that they would have to, but the endocrinologist that she was under that wouldn't even consider it. And eventually, when he finally did acknowledge that it was there, and he said, "I refer you to a doctor," he never did. And finally, we went outside the hospital we were at, and to another endocrinologist. She proved that it was hyperparathyroidism, and the tumours removed, and her blood calcium went back to a normal level on that. But that's done a lot of damage. It's the calcium abnormalities have done damage. She's got calcification of tissues, which problems, and simply because doctors wouldn't really look at it.
How did that make you and Rhea feel?
I think at times we get angry. It does make you get frustrated. Absolutely, very frustrating. No, she's been accused of having too many doctors. Well, she's got too many problems. We've had to change cardiologists because she had one cardiologist who was checking her pacemaker. Pacemaker was, according to him, was working well. And she asked him, "Then why don't I feel well?" And he answered back, "Oh, lots of people have got things wrong with them. They're not worried about it. Why are you?" Incredible attitude. And needless to say, we didn't stay with him. On that. So basically, and we get frustrated. We went to another cardiologist. His attitude was simply, she's got to lose weight. He didn't try to understand why. I don't think he knew that. And there were basically 3 or 4 admissions into emergency centre of one of Melbourne's major hospitals with shortness of breath, difficult breathing, and they rang the cardiologist up. Okay. "Oh no, it's not the heart. Nothing wrong with the heart." Well, nothing wrong with the heart. She's got a cardiomyopathy there. She's got atrial fibrillation. She's got AV node ablation. I would have, if my dog presented with those signs, I would assume I would look very strong for congestive heart failure. And they just put it down as asthma.
Do you think?
Oh, it made me determined. It's made me also want to try and encourage the people I deal with, the doctors and the staff and so forth, to really look at their patients with a fresh, basically look at it. Here we've got somebody who's got problems, which you could say a whole lot of separate things. But as we've understood it better, we realise they're not separate. They're all a result of the same genetic defect affecting the electrolytes within the cell. Cardiomyopathy, almost certainly the hyperparathyroidism, Sjogren's syndrome. At the moment we're having a big battle with the ophthalmologist to try and get the dry eyes treated effectively. I don't think they know how to treat it. And the problem is that too many of them don't want to know. If you don't fit, if you don't sort of respond to the treatment which we give everyone else, then we don't want to know it. Yes, I think that basically there'd be a lot of husbands would have walked away. I'm determined I won't. I made a promise to her 47 years ago that for better or for worse, I'm going to stay. I'll care for you. No, I still love her on that. So it's had that effect. And it's had effect right the way through on that. So it is that determination that no, there's times when I've really been very frustrated. And I get very frustrated when I get a doctor that will not look at her problems in the light of the evidence which we can present, that dismisses us as being cranks, and that's been done so long. She's been dismissed as a hypochondriac on that, and she's wondered, am I that? And it's no on that. So, and that's very frustrating. So it's that frustration which is that. Well, I am a diabetic, so one advantage that I have is I've got a good understanding of diabetes, and I'm determined to make sure that I keep the diabetes as best I can. Unfortunately, I do love my tucker too much, and as a result, I've got this nice little pregnancy here that Reeve and I had a race 35 years ago, and hers went down and mine didn't. On that, so trying to sort of, and that is a battle to try and keep the weight down. Some 3 years ago, about 6 weeks after I retired, I fell off a ladder and broke an ankle. And I spent 6 weeks, and I spent not a month in hospital, 10 days, and they waited to try and get the swelling down on the ankle before they did surgery. And half the time they didn't feed me, so I lost 16 kilograms. And I managed to keep that off. So that doing that is important. I think the other thing is actually trying to have a good attitude. My kids always refer to my dad jokes and so forth, but I do try and look at life with a bit of sense of humour. And I think the other thing that does me is a good relationship as a Christian, friends in church and so forth, relationship as a Christian, as a believing, somebody who believes in that. And that gives me a philosophy that allows me to look at it without getting overwhelmed by it. One of the problems with the medical field is, and it's probably a frustration I have because I was a general practitioner basically in the veterinary field, and done a lot of things which today wouldn't. But is the fragmentation of medicine into specialties. And so often somebody may have their specialty, and there may be something out to the side and they don't want to know about it. The example was the cardiologist I referred to before, who was checking the pacemaker, basically an electrocardiologist. He didn't want to look to see, okay, what is going on in this heart, apart from what the pacemaker was doing, and on that, and that's very often the case. And so often there's basically, we find doctors, there might be something going on there, and cardiologists, I must admit, are one of the worst. They've got a habit of looking at their own little things in isolation. Now, what's the effect at the moment she has got pulmonary hypertension? We'd love to get a drug called Bosentan, try that with her. But because she doesn't fit the box for Bosentan from the cardiologist's point of view, she can't get it. There's one measurement in the heart test which she can't get. Means that, okay, they will not that. Now, they won't even try it on her. So that could have a beneficial effect on the vasculitis and so forth. So and that's, okay, it's outside the cardiologist's field. And that's fragmentation. Instead of looking at a patient as a whole, they tend to look at a patient in their little organ fields and various specialties. The rheumatologists, unfortunately, rheumatologists, often they think of their own little branch of rheumatology even. No, the endocrinologist, she was under a endocrinologist who was very good with diabetes. No, not so bad with osteoporosis. His understanding of the parathyroid, even though he was reasonable knowledge of osteoporosis, his understanding of parathyroid is abysmal. And you couldn't tell him that. There are areas which are very good. The Cystic Fibrosis unit at the Alfred is very good at following up, and there are staff there which are absolutely superb. There's others which I wouldn't give you tuppence. A consultation regarding the eye recently, they sort of said, the cornea's healed, and they didn't know anything else. The fact that she wakes up in the morning with very painful dry eyes, they didn't want to know about it. And that. So this is areas which are, and they even just scrubbed her off. They refused to give her another appointment for that clinic. Yes, they have got a psychologist in the unit, and that's been discussed. It's of probably not sure that palliative care. We've after 10 years we've been referred into the palliative care, who've been very good in looking at her, not trying to think, well, okay, just palliative at the end stage. They're looking at how can we, what we do we need to try and make life the best possible way, and that attitude is good, and they on that. I think there needs to be a change of attitude I think there is sometimes too many things are put into too hard basket. She was admitted into the emergency department of the Atrial Hospital with chest pains. And it took them 3 hours before they took any blood from her on that. And by that stage, we suspected a possible heart attack, which is possible. And so often what happens is that she's got cystic fibrosis. Oh, well, she's going to die soon. We can't do that. But then when she needed shoulder surgery, she'd wrecked her shoulder and that. We can't do it because she won't take an anaesthetic. Well, she's had so many anaesthetics that they should know that is not a major problem. So we had to go outside the public hospital to get that done, and that was repaired. It was also found that the spinal cord was being compressed. So she had 2 lots of back surgery. She's had all under an anaesthetic. But then when she came to need the parathyroids tumours removed, too hard to give an anaesthetic. No, can't give an anaesthetic. We just won't even consider it. She'll have to live with it. Okay, the pains that's associated with it. Now, leaving a patient in pain is not a good thing. Doesn't matter how old they are. And I think there's got to be some of them may sort of turn around and say, look, no, it costs too much to look after this patient on that.
So what's the attitude change, do you think?
I think there's got to be a change of attitude. There are a lot of doctors who've got which are quite compassionate. Mm-hmm. Whether the administration of hospitals puts too much pressure, to try and keep the costs down, probably. That can probably happen on that. So basically, my aim is actually not to just do what is best for Riva. I'm also fighting to try and have what's best for people with cystic fibrosis and older people too. Cystic Fibrosis Community Care, which used to be called Cystic Fibrosis Victoria, but on that, involved in that, we do some encouragement, not that and the Cardiomyopathy Association of Australia is the other group I'm in that, and I am one of the directors on the CMAAA board, so I've joined that. No, they both presented quite good information. I think that both have an attitude of looking at trying to present an information which is up to date and appropriate on that. And trying to give guidance to try and find that information if they can't find themselves on that. So basically finding that has been very good. The cystic fibrosis have been very good at trying to look at CF and on that. There's still probably an emphasis on children's cystic fibrosis in children. In some ways, if you're raising money, that's the one that has a good tear-jerk reaction. Cystic fibrosis in geriatrics is that. But I do wonder, and I think this is one area, wonder how many people sitting in nursing homes have got chronic respiratory disease, chronic bowel disease, and it's undiagnosed cystic fibrosis. And on that, a year or so back, there was a lady diagnosed in California with cystic fibrosis. Her son was diagnosed at 57, so they tested her, and she was diagnosed at 92. So just because the thing is, people in their 60s and 70s and 80s never had GPs or specialists when they were children who could diagnose CF. There were no tests then. So they could have just, the milder forms of those could have just simply escaped, and they've been living with these problems. And now they've that. And if our experience is a good experience, Reva was diagnosed at age 67. She was put onto Creon. Her heart ejection fraction when she was put onto Creon was 23%. 9 months later, it had jumped to 46%. And that was the only change, was that she was put onto a drug which made her digestion better. Prior to the, she lost a large intestine, that she was having 3 and 4 bowel obstructions a year on that, with it. Since she's been on Creon, I think she's had 2 in 10 years on that, and they've been very minor on that. Basically, since Reva's diagnosis with CF, she wouldn't be eligible anyway to have life insurance because she was diagnosed at 67, so normally people of 67 don't take out life insurance. So basically for us, it's it really hasn't been an issue. Myself, okay, I'm no longer have life insurance, except for this one policy, fully paid up policy that's been sitting there for years, which I took out when I was many, many years ago when basically, and before I knew that I had diabetes or anything else. So at that stage it was. So reading my experience with life insurance is that I really haven't had any problems with life insurance.
Have you observed?
Travel insurance, that is a different issue, because that is a concern. Reva costs a lot more to get travel insurance for Reva, and they won't cover cystic fibrosis. And technically, you've got to be very careful what you tell them on that, because it's basically that. But so far we haven't had to claim on it ever.